following presentation was created as a part of the course requirements for human anatomy at Saddleback College. The carpals are 8 small bones which compose the human true wrist, or carpus. They are located between the end of the forearm, radius, ulna, and the metacarpals. Classified as short bones, the carpals do not possess a medullary cavity and correspond to the tarsus in the foot. The carpals provide the wrist with the ability to rotate and allow for lateral motion as well. This is a supinated right hand. Beginning at the head of the ulna is the lunate, scaphoid, trapezium, trapezoid, capitate, hamate, triquetrum, and pisiform. Note the protrusion on the hamate, known as the hamulus. This protrusion can be very useful as a landmark if you are unsure as to which aspect of the hand you are observing. If you can see the hamulus, you are observing the anterior or supinated aspect of the hand. From the posterior aspect, we have the lunate, scaphoid, trapezium, trapezoid, capitate, hamate, triquetrum, and pisiform. The carpals can be organized into the proximal and distal rows. The proximal row is composed of the scaphoid, lunate, triquetrum, and pisiform, while the trapezium, trapezoid, capitate, and hamate make up the distal row. These bones can also be viewed as 3 columns. The radial scaphoid column is made up of the scaphoid, trapezium, and trapezoid, while the lunate column consists of the lunate and the capitate. Finally, the ulnar triquetrum column is composed of the triquetrum and the hamate. The pisiform is not included in this view as it is categorized as a sesamoid bone of the ulna. The scaphoid is the largest of the carpals and is cashew-shaped, while the lunate is somewhat moon-shaped and named accordingly. The triquetrum is 3-sided, think tri, and the pisiform is the smallest of the carpals. The trapezium and the trapezoid are named after their semblance to those geometric shapes, but the trapezoid is much smaller. Similar in shape to the capital of a classical column, the capitate is the largest of the carpals. Finally, the hamate is easily identifiable by the presence of the hamulus, which protrudes from the anterior aspect. Only the lunate and the scaphoid connect to the forearm directly, articulating with the radius, forming the actual wrist joint, with connective and nervous tissue passing through the carpal tunnel. A lateral ligament joins the scaphoid to the radius, while a medial ligament connects the triquetrum to the ulna. The hamate articulates with metacarpals 4 and 5, the capitate with metacarpal 3, the trapezoid with metacarpal 2, and the trapezium with metacarpal 1. The carpals are connected to each other by several ligaments which allow for wrist flexibility. Each carpal row contains their own dorsal, palmar, and interoasis ligaments. In the proximal row, the 2 dorsal ligaments connect the scaphoid and the lunate, while the 2 palmar ligaments link the triquetrum with the lunate. There are 2 interoasis ligaments in the proximal row, joining the lunate to the scaphoid and the triquetrum. 3 additional ligaments are unique to the proximal row. The PCO-hamate articulates the pisiform to the hamulus of the hamate. while the PCO metacarpal secures the pisiform to metacarpal 5. Lastly, the capsular ligament surrounds the pisiform and the triquetrum. Moving on to the distal row, the 3 dorsal and palmar ligaments connect the trapezoid to the trapezium and to the capitate, as well as the capitate to the hamate. 3 more intraoasis ligaments join the capitate to the hamate and the trapezoid, and the trapezium to the trapezoid. Each row forms its own joints, referred to as the proximal and distal metacarpal joints, which are responsible for many of the movements associated with the wrist. These are plain synovial joints which allow for gliding motion to occur between the carpal bones. The 2 carpal rows articulate with each other through additional dorsal and palmar ligaments, which weave between them, as well as the lateral ligament, which connects the scaphoid to the trapezium, and the medial ligament, which joins the triquetrum to the hamate. The midcarpal joint is made up of bones from both rows, specifically the scaphoid, lunate, and triquetrum from the proximal row, and the entirety of the distal row. This joint is responsible for wrist flexion and extension. The radiocarpal, or wrist joint, is formed by the scaphoid and the lunate articulating with the radius, and allows for the majority of wrist movement. Several orthopedic and medical conditions can affect the carpals. Wrist pain can be the result of injury, such as a fracture, or a symptom of a disease. The scaphoid is the most commonly fractured of all the carpals, often due to falling with an arm outstretched. Serious cases could require surgical intervention on the behalf of an orthopedic surgeon. The clinical term, wrist fracture, however, actually refers to a break in the radius towards its distal end. Carpal tunnel syndrome, or CTS, is the compression of the medial nerve which travels from the forearm to the wrist through the carpal tunnel, hence the name. It occurs in only 5% of the general population. The cause is often unknown, though overworking the wrist could be a possible one. Common symptoms include pain, numbness, and tingling. However, pain may increase in severity over time and potentially extend along the arm. If left untreated, grip strength can weaken and even lead to muscle degeneration. Wrist splints can be used to provide support and corticosteroids prescribed to ease discomfort. However, if the condition does not resolve, surgery may be necessary. To review, there are 8 carpals, or wrist bones, which are located between the metacarpals and the distal end of the forearm. The lunate and the scaphoid articulate with the radius, forming the radiocarpal joint, and with the triquetrum and the pisiform make up the proximal row. The triquetrum articulates with the ulna through a ligament. The trapezium, trapezoid, capitate, and hamate articulate with the metacarpals and form the distal row. Ligaments not only join bones within the rows, but also join the rows with each other. From these connections arise distal and proximal joints within their respective rows, as well as the midcarpal joint, which includes bones from both rows. Several medical conditions can affect the carpals, including various kinds of fractures, as well as carpal tunnel syndrome, which is caused by the compression of a nerve running through the wrist. A useful mnemonic for remembering the names of the carpals, moving from the lateral to the medial sides, starting with the proximal row, is Sarah, left the party, to take Charlie home. The carpals are crucial as providers of wrist flexibility and movement, as well as major contributors to the function of the hand as a whole.